Hi, my name's Ruth Brown and I'm Acting Chief Executive at Sheffield Children's. We have nearly 4,000 outstanding, brilliant people who work across our trust and our charity. We provide care to children and young people in Sheffield, across the region and the UK. Our hearts go out to everyone who's lost family and friends during the COVID-19 pandemic. The last year has meant such a lot of change for everyone, personally and professionally. There are so many wonderful examples of things that people have done to care for each other, create new resources for families, and finding new ways to keep services going. We wanted to share just a few with you. I hope you enjoy this short film.
Virtual consultations has allowed for the continuity of services, especially for ones who are long-term patients, who are at a really high risk and needed to shield, and also those who are not able to travel. And more so importantly as well, that for staffs who are really high risk and who needed to quarantine, which allowed them to work from home to provide these outpatient services. Not only that, there are many other benefits which has really helped Mother Nature and the world we live in. By conducting 85,000 virtual appointments, 55 tons of CO2 emissions and 2 million travel miles has been avoided. And there is an appetite for ensuring new ways of working are not lost in the post-COVID-19 world.
The Capital team were tasked with repurposing vacant or unfit spaces. In 18 weeks, we refurbished the old M1 space to create a 16-bed unit now named Ward 7. We refurbished the old S1 to create new Ward 8. The sleep unit was relocated after the acute site to free up clinical space. And the team also completed the planned projects of the mortuary refurbishment, blue lift replacement, and repurposing of theatre corridor into statutory clinic rooms. To help people social distance, we also added screens to waiting areas throughout the trust. The team worked long hours and a substantial number of weekends to ensure these changes, and I am proud to be a member of such a committed team.
We've done a lot over the last 12 months to improve our health and wellbeing offer. So if you or a colleague need support, then reach out because it's there for you. This is what makes it part of a brilliant place to work at our trust. Can I just say a massive thank you for all the brilliant hard work and dedication that you've offered us. Thank you so much.
We had to find a way of helping children to continue to meet their targets, and we came up with lots of different ideas, and one of them being PowerPoint resources and making games so children could access these at home. We also discovered by using the Teams app that we could change our background to make it more interactive for the children coming to screen. So when we did a pirate activity, doing the treasure hunt, we could have an under the sea shipwreck background, as you can see, and the children think this is absolutely brilliant.
Based on the research that we've done, families have suggested that actually the relationship with a CF team, with a medical team, is really, really important to them. That consistency really helps them. Some families have mentioned that being able to access appointments virtually, whether that be by telephone or video, has been easier for them. While that's positive, it's not a replacement. So there are pros and cons to both, families are mentioning. And it's not that it's all one or all the other. It's actually, can these be used in combination for us?
Sheffield Children's is a specialist children's trust, and that meant that we were able to provide a sanctuary for children and young people during the pandemic. Over 600 patients came to us for surgery from across the region to help other hospitals care for adults. In Sheffield, our community services continue to care for the most vulnerable children in their own home, and our CAMS teams created new resources to help families with their emotional health and well-being. I'm outside the hospital at the moment, and this is also where members of the public dropped off over 8,500 masks that had been made at home for use by families when they needed to visit the hospital. The support from our patients and their families has been amazing.